Digital pathology is the act of transferring a glass slide that normally you will put under a microscope to see. Now transferring it into a digital form that you can project and view on the screen. And so you do the same thing you would do under the microscope. You do it by just sitting in front of your computer screen, and you are able to move around the slides, change the magnification, and focus on specific areas on the slide. Digital pathology is already positively impacting our clinical mission, but as we move ahead in the journey, we look forward to seeing a situation where pathologists, number one, are going to have the flexibility to access patients' material in different environments, not necessarily glued to a microscope in a particular location in their office. Now that is going to be especially significant in that you can call on 1, 2, 3, any number of other pathologists to consult on a difficult case without any one of them having to leave wherever they are. You can ask specific questions, not just show a pathologist and say, I want you to help me with this. But that pathologist doesn't have to go throughout the whole thing. You can just look at this place where the question is. It's going to help our clinical mission in that we can discuss cases with surgeons and oncologists and be able to show them exactly what we are looking at. It's almost like a radiologist sharing what he found on an image with a surgeon in the OR. So we can do that with tissue, and there are just so many other opportunities. Where are we in this process? We've gone a long way. We've done more than 70% of the preparatory work, which includes validating the digital pathology or the whole platform, just to prove that it is as good as the glass slides. So we are about 2 weeks into finishing that. So the whole goal is that by the end of the year 2026, at least 4 pathologists will be using this actively for clinical care, and maybe more than 4. But almost every pathologist will have access to it immediately for tumor boards, for example, for teaching and for sharing ideas and for asking for help with time. So we're pretty much close, and I think the most difficult steps are what we are going through right now. Once these are completed, the rest of the journey will happen faster than the ones that are already completed. 5 years time, I think there will probably be no more microscopes visible, and if you still see microscopes, they are probably going to serve as a backup. So right now, as we start, digital pathology is probably going to be a backup to the microscope. But I think in the next 5 years, most pathologists will have put aside their microscope successfully. I see digital pathology taking over the way we do research, the way we teach medical students, the way we teach residents, and the way we discuss patients and tumor boards. I see a lot of artificial intelligence, AI, algorithm now being fully deployed into clinical care, which is going to improve the objectivity of some measurements that needs to just be accurate to be able to determine the best care for patients. I think digital pathology is going to be something that new residents and new pathologists are going to think has always been around, and maybe when they see microscopes, they will start wondering what that structure is. Yeah, so I'm very excited about digital pathology, and I think it provides a lot of flexibility to practice pathology. And as we deploy more and more of AI, that is going to make practicing pathology easier and more reproducible than it is right now. It's just a matter of time before a pathologist insists that he must have the tool.